welcome everybody to the April meeting for the local Alcohol and Drug Planning Committee regular meeting. We get together monthly to feature different initiatives around alcohol and drug services, the SUD continuum, the nexus with behavioral health, and any other initiatives that our community has going. Thank you all for joining us. Well, our presentations today, I believe we have Denise and Jeremy's presentation regarding the strategic planning initiative and the update you guys have.
So today I have the needs assessment report findings to share with the LADPC. This report was generated by Comagine Health, and Stephanie is on the call today to answer any questions that arise once I go through the Comagine's presentation. So I'm going to go ahead and share my screen and jump right into this. I'm going to go through the needs assessment findings and then move into a slide that's kind of showing how Jackson County is already addressing many of the needs that were identified. And that's something I'd like to preface to say because I think it's really remarkable how quickly Jackson County moves. I think everyone was aware of what the needs were already, and so much work has been happening. So in doing this assessment of direct service providers and service users, we were able to collect feedback on where folks were finding some challenges that they felt needed to be addressed or bridged. But at the same time, simultaneously, all this excellent work has been happening across Jackson that is working to address these gaps. So I do want to frame today's conversation by saying that. Okay, so this report was developed by Aaron Stack and Karen Drill of Comagine Health, and it's basically an analysis of the quantitative and qualitative interviews and surveys conducted through the month of February and March. And the purpose is to share the key findings of the interviews with you all and discuss your feedback on the needs assessment report and process, and kind of collect some thoughts on where you feel priorities for next steps and actions would lie based on the findings. Just a review of how we conducted the process. Myself and Jeremy collaborated with all of you to recruit participants, so thank you so much. We completed 18 interviews with approximately 55 participants and collected 101 surveys from folks across sectors, including law enforcement, jail, probation, EMS, detox, housing, mental health, SED treatment, harm reduction, peer support, and people with lived experience. And at the end, we'd like to collect some reactions and thoughts to the data and some of your recommendations based on what this report shows. These are the areas we heard about from participants. We have kind of organized the report under resources and services, access barriers, gaps in services, needed services, and solutions. So we'll start with resources and services. And participants mentioned several substances of concern within Jackson County. As we know, fentanyl leading the list here, along with heroin, methamphetamine, alcohol, and cannabis. In addition to substance use, participants were concerned about mental health disorders and comorbid SUD and MHD. To address concerns, participants noted that the county has many services currently available, all listed here as you can see, and along with harm reduction, there was also syringe exchange was discussed in many of our interviews. Next, we'll look at some access barrier feedback we've received. Participant noted there were several barriers that discouraged people from entering or completing SUD treatment, and that included long wait lists for inpatient treatment, especially a lack of referrals and some bureaucracies. And this quote is saying, "We put in a lot of effort to get them engaged, then we walk away, or the treatment agency doesn't come in to support and the person wanders off. So we have to do the same effort over and over again." And the jail staff and law enforcement officers noted that not knowing what organizations provide SUD treatment in Jackson was the biggest barrier to making referrals to treatment. Participants also reported that a lack of services that provide basic needs was a major barrier. And we know that housing was predominant there, mostly due to loss of housing stock through the fires as well. Also, there was a need for additional community support and the need for culturally specific services, specifically services available for Spanish-speaking clients. Stigma was also brought up, along with philosophical differences across sectors that impeded collaboration. There was discussion of technology barriers that were mostly surrounding COVID-19, a lack of information sharing and understanding about the services, and some personal and interpersonal barriers, including unrealistic expectations, a lack of time management, fear income, and a lack of social support. Now we'll take a look at the gaps in services. So the major gaps in services that were brought up were around connecting people post-incarceration to peer-delivered services, treatment, and integration into the community, as well as connecting folks from release from the hospital and into the community, and then from completing treatment and then getting into some stable housing. And I'll go ahead and read this quote that says, there were folks who may be in dire need of SUD treatment and they are waiting weeks. They're getting minimal care while they wait. We try to patchwork things together. In my mind, this is a safety issue, especially if there's a lot of psychosocial stuff going on. If they're homeless, if they're experiencing interpersonal violence, they've got all of these other things going on and they're trying to moderate and establish abstinence. We need to get in there quickly before they lose motivation or experience another adverse outcome. We don't have the capacity right now in the county to do that well. And another participant described the need for warm handoffs and support between agencies. And I'm saying a participant, but this bullet was brought up by multiple participants. And this quote is a singular interviewee who shared that it is challenging when there's a motivated patient who wants to engage in some kind of treatment and we don't have the direct access to what they're asking for. It's such an important specific moment in time. If someone is ready, willing, and engaged, it would be great to say, here is what you need, and it's right in front of you. We know there is so much relapse potential that happens between the hospital stay and trying to get to your next inpatient treatment or outpatient support. Or if you're looking for MAT or methadone, it could be hard to get people signed up for methadone while they're in the hospital. Just having that direct access is always so beneficial when we can meet the person in that moment and say, here is the path forward. Now we'll take a look at the services that were highlighted as needed. Participants noted needed services to address barriers and gaps in services, such as, we know housing is a challenge, treatment options, most notably residential, additional detox facility, expanded jail facilities and supports within jail, medical and mental health support, especially for co-occurring mental health and SUD, skills training and protocols for persons working with people with use disorders, peer recovery support specialists, collaboration between organizations and partners, information sharing and to clients and potential clients and between agencies, Spanish-speaking services, and case management and more personalized supports. And solutions were also identified by participants, and some of these are actively being worked on, as we'll look on at in the next slide. There were needs for staffing and administrative support, including hiring a 24-hour on-call counselors, support more SUD treatment staff to complete assessments, offer higher income and a space for peer recovery support specialists, make peer-delivered services available in mental health clinics and probation offices, hire more community health workers and social workers, establish more mobile integrated healthcare providers to collaborate with EMS, and offer law enforcement officers more time to follow up with people who use drugs. Sector collaboration solutions included offering SUD assessments and group therapy at probation offices, expanding non-enforcement mobile teams for assessment, treatment, and rapid overdose response, and initiating law enforcement co-response with SUD or mental health professionals. And then it was also discussed the need for centralizing information sharing by creating a centralized place for people to get information and a centralized hub for communication among service sectors and between service sectors and law enforcement. And this last piece on criminal consequences, this was a unique set of participants and not a widely spread feeling throughout the needs assessment participants, but I'll defer to Comagine, but it seems that it might have been significant enough to bring here. But some folks, select participants, had said that solutions to criminal consequences could be requiring mandates for completing treatment, including through treatment courts, and provide law enforcement with more enforcement power, including the repeal of Measure 110. So now I just want to pop over here and share this slide so we can look at all the work that Jackson is currently doing to address many of these needs that are identified. And we could see that with the burn and the pending grant funding that's coming, already in the works is a plan to increase assessments, coordinate assessments with law enforcement, and coordinate expanded referrals and capability to make referrals, expanded intensive case management, connection to peer supports, and building capacity for culturally and linguistically responsive services, which we see is happening now with Recovery Cafe. And then within the crisis response network, they are currently working on their planning for non-enforcement mobile response teams, law enforcement co-response with SUD and mental health professionals, more integrated healthcare providers to collaborate with EMS, and enhance connection to mental health services. And other local work groups, such as members of the LADPC, the naloxone work group, the MAT work groups, are addressing actions towards addressing the challenges with fentanyl use, outpatient buprenorphine induction, overdose prevention, harm reduction in naloxone, distribution training, syringe exchange, I'm just putting that on here, expanding housing capacity, and increasing public awareness and education. So the space that might be best, if the county felt is true to focus the SPI strategizing on, could be around actions to coordinate warm handoffs and referrals between agencies for existing and returning patients, creating awareness of county services and initiatives, enhancing interagency community pathways, which Jeremy has a great thing he's working on to share with everyone, and then staff training and team facilitation around addressing stigma and philosophical alignment. So that is the presentation. And now I'd love to hear your thoughts and feedback.
Yeah, Lori, is that your hand up?
Yeah,
okay.
Thank you.
Yeah.
Where does the navigation center come in?
In the solutions?
Mm-hmm.
So the solutions, excuse me, the solutions that were identified were just things that people just came up with. That is not part of the strategic plan. It was just added as the needs assessment because it was ideas that they had at the moment for needs that they had expressed. So the navigation center would be on part of that coordination and case management and some of those other things. And as we move from needs to strategic plan, we'll be able to draw those out, and there'll be the report will reflect those, that this is already in process or this has been identified. But so that's how that came up.
Great.
And I think, Lori, where that's falling in is would come in under the need for awareness to the across direct service providers of the navigation center as a resource. So we can put that under the action of enhanced communication to make sure people know.
Yeah, that kind of communication is also required for the burn, to do heavy advertising throughout the county to make everybody aware of what exists and how to access. So I don't know if you're aware of the burn level requirements too.
So a lot of the things people identified as needs and even solutions, the burn, I was sitting there going, that's Measure 110. But as we're listening to that, the funding just kept getting moved and all of these other things. And so those needs and solutions are a moment in time. And at that moment in time, they were needed. And because there wasn't bird in the hand, I think is the saying, I couldn't really identify that they were going to be funded or how that was going to be or any of those things. So as time moves and we get closer to funding, hopefully the funding comes before the strategic plan is complete.
Thank you, Jeremy.
Yeah, and you're bringing up the great challenge of this project, Lori, in that its timing is not well synced with the plans for the burn. So I think the strategic planning initiative is really going to be looking to the county to tell us where you would like us, what areas you would like us to focus on in developing some low barrier, low cost actions with work groups. Because again, the findings in this needs assessment are just what the county was sharing back with us. And we'd be looking to you all to share where you feel the priority for this piece of work would be for us to complete it.
So I have some feedback. This is Marty with Oxford House, by the way. As a CRM and a PSS, and also as a person with lived experience, the frustration with all the lack of services for people presenting these issues is huge. And I think to see this is amazing because it literally hits every single thing that all of us in the field are always talking about. It's everything. So I commend you on the scope and the breadth of the work. I just want to know what's the next step? And I'm super frustrated with the Measure 110 push out. I think it's till October. I know that sucks, but this is just so amazing. And I just want to see would like to know when this is moving forward.
Thank you, Marty. I appreciate that. And I appreciate all the effort Jackson made to bring participants to the table to contribute to the needs assessment. And the next plan is in March at our leadership meeting, the SPI leadership meeting at noon, the second week of May. We'll be using that as a workshop to brainstorm where do you want us to focus our efforts? What are the low barrier, low cost spaces where we can help strategize enhancing coordination, for example, if that is a goal that you would like to work towards while we're in this holding pattern with burn funding being received, or what area you all are the feet on the ground. So the best to advise what areas you feel we can work in. And then in that space, we could start pulling people into additional meetings in May and June to start, brainstorming the actions that will go into the strategic plan.
Marty, some of my design from the beginning of this was that looking for solutions. So how this is different than the other assessments is they're often looking for the big picture, the capacity, those $2 million solutions. I wanted to also identify solutions that can be done on a staff level, just without lots of money, maybe a simple policy or procedure change, or just more information, sharing of information, finding a hub, finding some way to fill those gaps that isn't always dollars and cents.
And some of that could be, kind of group trainings on where to refer people to, based on, if they're a mother who is seeking medication assisted treatment and, knowing to send them over to Oasis, or, kind of helping people know what the different services are that are available, because that was coming up as kind of a need to know, especially for folks who aren't SUD service providers and are part of the wraparound service network. So that could be a space that might be helpful to strategize in.
I just want to thank you guys for putting this together, because this is probably one of the most realistic, actual presentations that I've seen for needs and concerns. So thank you, Denise and Jeremy, and I don't know who else helped on that, but this is very well put together. So thank you.
Thank you, Justin. And we'll be sharing out the final report. We collected some edits. The final needs assessment report will go out to everybody who participated in the needs assessment, everyone who's here on this call at the very beginning of May. Comagin is working to finalize the final report the end of this week. So you'll all have a copy if you haven't had one yet.
Denise, thank you, and Jeremy, for sharing today. Are there plans to make this an ongoing process, or 2 years from now to pick it back up and say, okay, now where are we at? How have we done? Is this going to be a living document that could move forward and grow as our community responds?
Yeah, this will be a living document with Jackson County. This is your strategic plan, and it's yours to have. And that's an interesting question, Eric, because something that's been on my mind to ask OHA is, do they have plans? I think OHA is curious about if this is feeling like a worthwhile project to the counties, and if they would like to see it happen, they continue. If you'd like this continued support to see these actions through. So that's something I think and there'll be an evaluation when we wrap this project, end of June, beginning of July, where you could give that feedback and say if you felt this was valuable to you, or if you would like to see it, if you would like continued support to continue seeing the actions through. But this will be your strategic plan to do with as you feel is best for your community.
And Denise, not to be overly glib, but yes, Oregon Health Authority, we would love for strategic planning to be integral to the way they provide services in our community, particularly with local feedback. Like at its core, that's what I hope they aspire to. So
thank you. I'm going to say that when I meet with OHA next month, because I think they'll be glad to hear that. I think we're curious, there's curiosity on, was this a worthwhile endeavor? I know it was a frustrating one in that the timing didn't work well from the start. And there was, all pieces were in sync across multiple initiatives. But I think, once the wheels got on, it felt like a really wonderful experience working in Jackson County with you all. And I think OHA would be glad to hear you would like to continue.
And will be some continuation and coordination within subgroups of this. So like the medication assisted treatment group, which JCC has funded to help me roll that out and do some things around that. So that's one area. Sarah Smith and her naloxone group. But yes, Eric, with a little bit of funding, it'd be great to have a centralized place where a lot of that movement can happen.
Mm-hmm.
And I just want to reiterate, it's shocking that the health authority doesn't have a strategic plan, even though one was provided. And so, I look for it. I look for their outcomes, goals, and indicators as to how they're doing. And this is a major step towards that, which would be great. But, this is a really dire problem in our community. People are really suffering, hurting, and dying. And we need that state level of support and coordination, or else we're going to continue to have people being harmed. So not to be overly dire, not to keep hammering the same nail, which I basically do every month, but thank you for your work on this, because I think it's an area that we could really benefit from.
And it's true. What you're saying is true, Eric. And I think it would be great to see Jackson funded to continue this, so that, you have the capacity, and Jeremy or whoever else you elect to have part of your community work to be able to keep the coordination going. So it's not, beginning some works that are actionable and then it stalls because there's not the capacity or funding. So I think a great piece of the strategic plan will be laying out how you want to coordinate and expand this work in the future to say, let it be funded.
Right.
Thank you.
All right.
Oh, you have a question, Tanya?
Are there any more? Tanya. Yeah, go ahead.
Yeah, I would just say, since Jackson-Josephine County, our CHA, which is our community health assessment, community health improvement plan, and then there is a strategic plan that is developed, that this would actually be integrated into that, because there's a lot of work that goes into that with a lot of partners from here, both CCOs, both counties, that I think this work could easily fit into. So instead of even funding, this work and choosing to fund a CHA and CHIP, which CCOs are required, public health's required, hospitals are required. There's a lot of requirements around having those plans that this fit into that. So, and that would, I think, reduce some duplication work as well. So
does that plan, Tanya, live with Jefferson Regional Health Alliance, I ask? Is that where that plan sits as a living document that they update? And Laura, you're indicating.
Yeah,
okay.
Yeah, it really is. So how it was developed, it's like they're a neutral party. So it's not the county owns it or a CCO owns it. So they're that neutral party that then brings all of those players into that. We are at Jackson County Public Health hiring a CHA CHIP coordinator that works hand in hand with whomever JRH identifies. So it's really those two agencies too that help lead a lot of the effort with those three bodies of work. And COVID, of course, interrupted a lot of us being able to take that strategic plan and having an action plan for all of the different things that we as a community agreed to address, which part of that is around behavioral health and substance use disorder. So, I mean, I think the information that you brought and the feedback I can see that group using it, but I think there's an opportunity to integrate it.
That sounds good, Tanya. And I think hearing this, I think what I'll do is take the chip and use that as the template for the strategic plan to put these pieces where they're falling within the chip. And maybe that's the way to have it live. And so it is kind of one body of work. And this is expanding on the actions that were already identified in the chip.
Yeah, let me know if you need anything, because the
Okay.
chip, our internal staff did write that and do all the formatting. So let me know and
Okay.
happy to help in any way.
I could do an outline layout and run it through you to see if that looks like the right way to set it up and then move from there.
Yeah, that works.
Okay, wonderful. Thank you.
All right. Well, thank you. Thank you all so much for your work on that.